morning, everybody. So, a pleasant day, and I think I have met most of you people before even, but I would like to introduce myself now that I am Dr. Varghese Senior Consultant, Neurosurgeon, and Neurointerventionist. So, what we do by neurointervention means, without opening the skull, So what we do in neurointervention is, we don't open the skull. So without opening the skull, we will do the surgeries, which usually in olden days we used to do by opening the skull. Not all surgeries can be done through neurointervention. Some of them, mostly, which affects the blood vessels which are supplying the blood, brain, can be done by this procedure. So here we have one patient who met with an accident, and the problem what she faced was, after accident, she had some head injury with some fractures of the skull, and she was managed conservatively and she was sent home. After a few days, she realized that she has got vomiting sensation and she had blurring of vision of both the eyes. And she also noticed that there is a redness of both the eyes, and along with that, some bulging of the eye is also happening progressively over a period of few days. Definitely it's alarming as we see that the eye is becoming more and more red progressively, vision is progressively being lost, and the eyes are bulging on both the sides. So she consulted someone and she found that the whatever conservative management is not working. That is when she came to Apollo I1. What we do in such cases, when we have a head injury and we find that some of the vessels are not doing perfectly well, we have to study about the vessels. Am I right? So blood vessels which supply the brain have to be studied. The best way to study about a blood vessel is a dynamic study. You may be knowing about static studies. When we say static study, what we mean is CT scan, MRI. When we take an MRI, what we get? We will get a film. It is just a photograph. It's not a video. But when we see a video, we can understand more. Am I right? For example, I see a photograph. I cannot say whether you can talk or not, you can walk or not. But when I see a video of yours, I know you can walk, you can talk, and so on. So more details can be seen. So in this patient also, we opted to do a dynamic study that is called DSA, Digital Subtraction Angiography. This is done in a cath lab. It is not done in MRI or CT scan machine. It is done in a cath lab. So you might be knowing about cath lab. When a heart attack happens, the patient is taken for angioplasty. Where do we do the cardiac angioplasty? In a cath lab. So here the patient was taken to a cath lab and we did a DSA. When we say digital subtraction means we have to subtract something. What we have to subtract is we have to subtract the brain and the skull so that we can see the blood vessels properly. So when we say DSA, digital subtraction angiography, we take the angiography and subtract the bony element so that we can see the blood vessels very clearly, and it's dynamic. It is just like a flow. Like the blood flows through the blood vessel, we can see. So that is the advantage of doing a DSA.
And condolences to Mrs. Lalita and her family, because they've really gone through a lot. And we must acknowledge the fact that it takes a lot of courage from one to, even allow or be able to speak about it. So we must thank her from the bottom of our heart. It's kind of lucky in a way that our doctors at the hospital, especially at our new and one of our youngest hospitals on OMR, had an opportunity to do something. Sometimes we keep thinking that, we have to do something which is new and path-breaking. And even though it was under such tragic circumstances, it still happened. And for that, I'm so thankful. Dr. Joy Varghese is literally a person, a hero who works 24/7 to make a difference in people's lives. He's constantly there and constantly trying to do something which raises the bar on how neurosurgery and neurosciences are available to our people in the city. Globally, it's been advancing in leaps and bounds, but over 30 million people in India suffer from neurological diseases. And I don't think everyone is, aware of that data. Also in the event of a stroke, where it shows up as a weakness in our limbs, if there is like immediate and early intervention, it makes a huge difference. People don't have to be debilitated, they don't have to lose the quality of their life if they can come into a good center and they can have a neurological intervention. And I think Dr. Joy Varghese has shown time and time again how good he is at what in that aspect. And for us as a company, we feel we have to focus on neurosciences, because that again is one of the largest and the most complex areas in medical science. We've worked very hard to bring the level of cardiology, cardiac surgery to one of the best globally in our country. We're working towards doing a lot of work in oncology, but trauma is the one which really, if it's done well and if it's done right, can make a huge difference. And backed by a good neuroscience team, which is the neurologists and the neurosurgeons, I think that is really important. And of course, you need to have very good equipment to support that. So as a center of excellence, I think our hospital in OMR, even though it's not like a huge center, but it's one of the best centers globally now for the neurology work, for the neurosurgical work, and I'd like to congratulate the team too, who is doing that. But having said that, I think it's just, this particular procedure which doctor has done is something truly path-breaking. I don't know if it's definitely hasn't been done in India for sure. In the rest of the world, maybe very few instances is what I understand. So I think that is important, that India can show the rest of the world that whatever is possible, we can do it. And I think those are the kind of things which we should all focus on. And always remember that whatever happens in India, in the best of centers, the best of work which is being done, it's at 1/10 of the cost globally. And I think, while we always say, healthcare is expensive and the costs are high and so on and so forth, we should also side by side say that whatever we do, we're doing it at 1/10 of the global costs, same if not better outcomes, fantastic interventions, because equipment is the same throughout the world. Space has a huge cost. People, clinicians, support staff, they come at a cost also, which is not global cost, but which gives us an opportunity to deliver that standard at Indian costs. And I think that we must acknowledge and really salute the way our doctors are doing this kind of work. The clinical aspect, I think you've all seen, watched, and just heard from Doctor's fantastic presentation. But he's always available for any questions. We should be happy to answer whatever questions you have on this fantastic clinical work which has been done.